It is Mental Health Awareness Month in May. So, my first question for you, Felicity, is what is the link between mental health and obesity?
The link between mental health and obesity relates to the psychosocial burden that people with weight related problems suffer as a result of excess weight. And that can be multitude of issues that individuals are dealing with. So it might be things related to mood, self-esteem, quality of life, and body image. And emotional distress really does play a big part in what people are seeking treatment for.
Now, as the leader and pioneer of surgical weight loss in Australia, what are you most concerned about the state of mental health in Australia?
I think the problem is forever growing to a level that we really need to look at what are our treatment modalities and how are we reaching out and helping a population that seems to be suffering more and more from the impact of psychological issues, whether it's anxiety, depression, clinical depression, all of these things that seem to play a part in how we function every day in life. And I think the post COVID aftermath, we're still in that phase. I don't believe that we've kind of conquered all of the issues that we dealt with in that period. So, 3 years down the track, I feel and I see and I hear the stories of people every single day that the mental health issues that they're dealing with seem to be getting more and more prevalent and not reducing. So, I think the pressure on us in life in general is it's ever snowballing. Those pressures that we have, whether it's from work or family or financial, whatever that looks like, that we're all suffering from some area in our lives of mental health. But how do we deal with it? What are the things that we can do to treat and better manage our stress related issues?
You mentioned COVID. From what you've seen, whether through your community or in general Australian population, that seems to have, when we talk about people that's put on a lot of weight from COVID, do you think there is a link between what they were going through as the impact of the lockdown, being isolated, to gaining weight?
It's 100% exacerbated the weight related problems that people are experiencing. So, first of all, you'd see people isolated and working on Zoom from home, or isolated and in a situation where they actually weren't able to work. So, weight gain definitely was an issue, but we know already that our weight related problems are increasing in our population anyway. I think it's just actually made it worse. So increased weight gain definitely, but if we look at our statistics, Australia by 2030, we're looking at 1 in 2 in our population who will have some kind of weight related complication or overweight, obesity, or other medical complication in relation to excess weight.
1 in 2 is massive. But why is there such a stigma still around obesity?
That's a really interesting question, and the stigma that people suffer as a result of their obesity is really quite staggering, and it can impact a person's health and well-being on a number of different levels. And this discrimination that we see can be in the workplace and amongst their peers or education. It can be media and family and friends as well. So that people are unfairly treated because of their weight or size is an issue that I find really staggering and something that definitely needs more attention. In fact, even one of the statistics that I've noticed is that more than half of our health professionals show some form of weight bias, according to a range of Australian and international studies. So we need to really be reaching health professionals as well and getting them to drive new innovative therapeutic relationships with their patients, but definitely reducing the stigma associated with excess weight for sure.
Wow. Now, I know that WLSA have a lifestyle modification program, and within that, you have a team of psychologists in house that provide your bariatric patients with unlimited support from pre to post surgery. What is the percentage of WLSA bariatric patients that has some form of mental health challenges when they started their journey, and how has holistic weight loss improved it for them?
First of all, I think we all have some kind of level of issue or mental health concern that needs dealing with. None of us are immune from it. So let's just kind of touch on the fact that we've all got something somewhere at some point in time. It might not be something that you're dealing with all of the time, but some of the time. If I was to quote a statistic on my patient population, I'd say well over 95% of patients. So, whether it's anxiety or depression or the medications that they're currently taking that can have an impact on mood, self esteem, whatever that looks like, anxiety, depression, some form of mental health complication. And it might even come from past history and what they've dealt with that's led to the point in time where they're seeking help for something more serious to really manage their weight and their health. And having a team of psychologists in house, to me, is one of the most critical things that we could have developed and evolved over the last 23 years. And if I think back to when I first started 23 years ago, people were so frightened of seeing a psychologist. They thought they were being tested and whether they were going to be approved or not. Luckily, now I think we've got a much greater acceptance of the role of psychologists in our practice and understand the benefit of what does that connection look like. And I still believe that there's so much more room for improvement in that patient relationship. First of all, accepting that this is such a great opportunity for each and every patient to work on the past. You can deal with download and deal with whatever you need to, but also build new strategies for the future. And so the biggest piece for me in terms of what the psychologists offer is really managing to set people up for success. That's what we want to do.
That's so important. I read one particular story on WLSA website. This patient, and because she's publicly shared it, her name is Kimberly Hume. We first got her story in October 2022. And in that story was very long written, like a testimonial that she wanted to share with the world, how weight loss has helped change and regain a new lease on life. But it's only recently, the last update that we got from Kimberly in December, just a few months ago, where she wrote a much shorter story, but she mentioned mental illness. And I'll read this out. This is what she wrote. Throughout October, I walked 60 kms to raise awareness and funds for Black Dog Institute, a cause I deeply care about. It made me reflect on all the changes this process has had on me, not only physically, but mentally. I live with mental illness, a chronic condition, but since losing nearly 60 kilos, I have been in remission. I can move my body now. Exercise for my disorder has the effect of taking antidepressants. I literally have my life back in all ways. So I guess this is just a thank you to WSA and a reminder to all to trust the process. Now, Felicity, how often do you hear stories like this, and what does it mean to you?
That is the most beautifully expressed story, and there's a couple of really key points in there. That exercise really is the best medicine that you can give to a patient. And I love Kimberly's attitude, her approach, her commitment to herself. She's actually worked to make this happen. No one's done it for her, and I think she's just amazing. I also think that she's used the word remission really, really well, that to understand that everything that she does, her approach to managing her lifestyle every single day, has put that chronic disease of her depression, anxiety into remission. And that's something that you can take control of, but in an environment where you've got an incredible support network. So, for a patient who's actually bought into that opportunity and had a team of people supporting her, I know she was on our Gold Coast Marathon team last year. She's an absolute superstar, and I think sharing that story is phenomenal, and it does resonate with so many other patients. But getting them to step out of their comfort zones and take on board those lifestyle changes, that's the critical piece of creating positive behavioral change that is going to change your life. It's totally life transforming. I absolutely love that story. Kimberly, just amazing. It's beautiful, and it really makes my heart sing. When I hear these kind of stories every day, these are the things that make me feel like, oh my gosh, this is just the best place to work on the planet. Having that opportunity to work with a team of people to create those changes, I feel very fortunate to be a part of that, and just listening to that story is phenomenal.
Yeah, absolutely. Kimberly's story shows a lot of courage from her part to come up so upfront about her conditions. It's also very empowering for her to share her story out loud like that in a community. Do you hear the stories all the time through your practice?
Literally on a daily basis. This is the
Wow.
kind of story that we hear from people daily. In fact, if you think about the stories that we're hearing right at the beginning, that first phone call is often one of the hardest because you're taking ownership of a problem. And we've been so conditioned to believing that when it comes to weight and morbid obesity, that we should be able to do it ourselves. And that's actually not the truth. So for people to actually break away from that socially conditioned belief to take that first step is a really tough one. So, in those initial conversations, hearing about what are some of the things that people are dealing with, so many of them won't even step outside of their own front doors because they don't look good, feel good, and they're missing out on having a normal social life. And so, giving people that opportunity for change is just phenomenal, and I really love it. But I can honestly tell you that it's a lot of people, and Kimberly's story for sure would resonate with many.
Yeah, absolutely. Felicity, you shared so passionately about what goes through your practice, Weight Loss Solution Australia, on a daily basis, and the fact that one of out of two Australians will be challenged with some form of weight issues by 2030. Knowing the statistics and what you see every day, what would you like to see changed?
So, first of all, coming back to your issue and your question around weight stigma, if we can reduce the judgment and the stigma so that people feel more confident to step up and ask for help, like Kimberly did, that would be a really great first step. And when I also mentioned to you earlier that our health professionals also need to change their behavior styles so that they're willing and capable and understanding of how they can actually better guide and treat patients. So there is still that stigma of we should be able to do this ourselves. And that's actually, first of all, it's not reality, but statistically, what we know is that 98% of diet and exercise programs are going to fail at some point, whether it's 1 year out or 5 years out. And we're talking about patients who, at a certain BMI, are not going to be successful alone.
Hmm.
So, changing that whole mode of thought processes so that people understand that reaching out for help is a good thing. It's empowering. It's taking your life into your own hands and controlling your future destiny. And we can help people do that. We can get them off the medications. We can hopefully prevent future complications from being overweight and reduce so many comorbid conditions that go hand in hand with excess weight. So, yes, I think coming back to reducing the stigma and allowing more health professionals to refer with confidence so that patients are seeking help and that patients also have the self confidence and the support networks, whether it's in their own families. I hear people constantly, when we're talking to them, say to me, oh, I need to check with my partner and my partner's not on board, or I'm really worried about what my partner's going to think. So, changing the dynamics of the conversation so that people actually look at health first, quality of life, outcome focused, and not blame. You're not being blamed for where you're at now, but we can help change it.
It's not your fault. It's such a impactful line to say to someone who's suffering from this. Felicity, if today I give you a superpower and you have the power to influence, set, or change one policy in Australia, what would be the first thing you would do?
So, first of all, I would look at treating the cause of so many of the medical concerns that patients are suffering from when it comes to weight and morbid obesity and make this the first line of a priority, prioritizing understanding the burden of obesity that is going to create an impact on our health systems down the track if we're not having a more conscientious process around managing it now. And that includes surgical obesity access. So this is the way that we effectively know that we can treat and improve our entire population. So that would be my first line of what would I do is look at managing the obesity first so that we can actually reduce and improve all these other medical conditions that people are suffering from rather than increase type 2 diabetes medication have a population who are increasingly, ones with sleep apnea, sleeping with CPAP machines. Let's look at the underlying causes for so many of these problems that can be solved with better weight management. It might also be hips, knees, joints. Before we give patients a hip or a knee that maybe they're not going to use effectively, what about we manage the weight issues and concerns first? So that will probably be my first point of contact.
That's amazing. To close off this, Felicity, May as the Mental Health Awareness Month, what would be the top three advice that you can give to anyone who's suffering from both obesity and mental health challenges right now? What can they do throughout this month of mental health awareness?
I think number one, do not suffer in silence. That's probably one of the most key things that people are dealing with. Anxiety, depression, and those problems, they can snowball overnight sometimes, but not having a person or someone that you feel confident to reach out to deal with that can be really problematic. So do not suffer in silence is my number one key tip. Reach out. And that might also mean leading into step number two, find your tribe and your community, because I think community support is a really critical piece in managing any mental health issues. So whatever that tribe looks like, I would be going there. And number three, increase your movement daily. And that might mean, what about forest bathing? We know that 20 minutes outdoors can have such a huge impact on mental health. Getting in touch with nature and feeling more grounded. There's so many different little things. So I'd look at maybe, are you getting out and moving and focusing on a bit of self-care? So maybe that 20 minutes in nature, or maybe think about trying something new this month, a yoga class. It can be something that's movement orientated, but with a focus on your mental health. Or if I can add one more, I'm going to give number four. What about a meditation app on your phone to help you? Because often if you're dealing with mental health issues, your sleep might be compromised. And if you're not getting good quality sleep, that's also going to have a resounding ongoing domino effect. So what about start with just a meditation app that might help you at night time to get better sleep and help you relax a little bit more?
What you just shared, the four advice that you've given, I can summarize that on what you're doing at WSA, and you've been doing it for such a long time. You have a thriving community of who we call the weight loss warriors. So they're patients, and there are thousands of them, and you gather them for different events throughout the year, and there is such a strong sense of togetherness. Like you first said, number one is do not suffer in silence, and you can see this conversation that are so open, vulnerable, honest, and genuine that's going on in your private Facebook group, because everyone is on the same journey together and supporting and cheering each other on. And how you bring a big team together for the Gold Coast Marathon and giving them weekly bootcamp trainings. And it's just amazing to see that happening. But you've done it not just within patients that's come through to your practice. You've also this year started a new program called the Year of Yes to reach out to people that are probably not ready to talk about surgical weight loss or medical interventions, but to help them feel there is a community they can connect with, obviously guided by you, to go through these different things in life where they can learn to move their body, they can learn to think differently. Just to finish off, Felicity, what would you say to people who may feel like they are suffering in silence right now? What can the Year of Yes, this thing that you've created, can do for them, and how can they join?
So they can join via the WLSA website. But what I love about the Year of Yes is that it's a tribe of people who have a positive outlook on what 2023 is going to bring them if they commit. Having a commitment to self and self development is our month at the moment that we're focused on right now. But each and every month we have another theme. So those building blocks of working on all these aspects that are going to make you stronger, more resilient, more competent, feel better in yourself, and have a positive outlook on what you can achieve by the end of 2023 is just fabulous. And I love it. I actually love it for myself personally as well, because I'm working with the community but it's also working on myself as well. There's no limit here. We can all continually improve, learn, and better ourselves in so many aspects of life. So it's just fabulous. I love it. I love what it brings to our community, that it collectively brings people together, and just a thriving, positive contribution to an amazing year. And I would just say to anyone, just jump on board, give it a go for a month. I'd love to have you there.